every major pillar of the U.S. healthcare system as a statement of economic fact makes money when Americans get sick.
We have to decide who are the constituents of the American government. Is it industry or is it the American people?
I'm here where the action is going to happen today. I came for a hearing in the Russell Senate building. It is a bipartisan hearing on how to prevent chronic disease and treat it. I'm very excited, and I actually came down because in all my days I've never seen anything like this, where there's a hearing to actually address the issues with our food system that are enhancing chronic disease instead of preventing it. I'm hoping that we talk about things like food additives, preservatives, dyes, but also bigger picture things like access to real food from local farmers, raw milk, and maybe even shots, because what good is it to eat all the best food in the world if we're injecting ourselves or forced to inject ourselves with adjuvants and chemicals that are doing our bodies no favors, to put it lightly. So I'm eager to see also what the attendees have to say, in addition to the speakers that are going to be on the floor. And is anything going to really come of this? Stay tuned. I'm going to try to get to as many people as I can and find out their thoughts on the matter. And then I will hopefully do a follow-up so we can find out what came of the hearing.
We have lived for this day, Hilda. We have lived for this day. You know, we know that, yes, there's some issues with infectious disease, but they've gotten all the attention for the last, 70 years, and chronic disease has gotten none. And what we know is chronic disease has been pretty profitable for pharma and for the medical establishment. So it's so exciting that Senator Johnson is convening this group to talk about, let's end this. Let's get this done with.
I think this conversation is really exploding all over the country right now. So this is just exemplified by this incredible hearing that Senator Johnson is having. But Callie means, Casey means, and there was just like a tumultuous event that happened when he and his sister appeared on Tucker Carlson, and I think really just laid out. I just thought, like, when I watched that interview, I was like, I think that's the Highwire, the work that I've done for like the last 7 years, packed into like the most concise 2 hours I've ever seen. Seeing Robert Kennedy Jr. celebrate that, hearing words like "Make America Healthy Again" on Donald Trump's mouth, it just shows you that there's a shift happening in this country, and a very, very important one. We have the most toxic food in the world, as Casey and Callie have pointed out so clearly. There are products that we have in America, like Fruit Loops, that have toxic chemicals in them that are not in the Fruit Loops in Europe. So that we are being poisoned more than every other country. And I think in America, we've always thought that like we held the standard, that we were at the top, of the pyramid of health. And when you start recognizing that we are being poisoned more than any other country in the world, I think that that's waking people up.
These chemicals were created to mimic real food, to make it easier and cheaper for food manufacturers to preserve their food, to make it last longer on the shelf, to help manufacturing, and sinister of all, to allow them to create products that are more addictive in nature.
When you see the rate of chronic illness in this country, it's really, I've been doing interviews. I was just at 2 different chiropractic conventions over the last weekend, and just talking to them about what they've seen with health of people coming through the door, and talking to young people. I interviewed a bunch of young people that said, I think 7 or 8 out of 10 kids around me is on a pharmaceutical drug while they're in school. The girls they're like, I don't think I know any girl that isn't on an antidepressant.
Oh, no.
The boys are like, yeah, all my friends are on Ritalin and these. So we have a drug society, and a generation that's coming up that will be adults and never really had a sober day in their lives. Like, it's shocking that we've accepted this level of health issues and chronic illness, autoimmune diseases.
We are fatter than any prior generation at this age. We're having more fertility issues. New cancer diagnoses in the U.S. are projected to top 2 million for the first time this year, and these new cases are almost all driven by young people.
Americans do not want to be sick. I don't believe it. It's the trillions of dollars of incentives that are in the way, and we must urgently remove corruption from the USDA, the CDC, the NIH, and our other medical institutions.
How is it that Americans are so chronically ill despite spending more on healthcare than any other nation? The answer is simple. Private industry has traded patient outcomes and public health for quarterly profits and earnings.
When your regulatory agencies are just signing off on food additives, dyes, chemicals that are in your food, in your water, the PFAS chemicals, the plastics, all of this stuff is really, really destroying our health. And so for me, I'm focused on vaccines. One of the things that people say, well, how do you know it's not the food? How do you know it's not the air or the water or the hormones or all the drugs given to our cattle and the food that we eat and pesticides on our food? I said, look, I sue the government on all of those issues, but let's be clear. Every single one of those products all came through the same pipeline, were accepted by the exact same regulatory agencies. So no matter what you think this disease crisis is being caused by, the number one culprit is our regulatory agencies. FDA, CDC, NIH, Health and Human Services have not protected the people. They protected the corporations that are poisoning us, and it is time to get inside this Capitol and change that immediately.
They're basically rubber stamping and approving it all.
Getting kickbacks. So much of this, just these simple things would be like no more kickbacks allowed. You're not allowed to get funded by the very industries you're supposed to be regulating.
Why should America, the greatest country on earth, be the last developed nation to protect its people?
I didn't learn that 82% of independently funded studies show harm from processed food, while 93% of industry-sponsored studies reflect no harm. In medical school, I didn't learn that 95% of the people who created the recent USDA food guidelines for America had significant conflicts of interest with the food industry. I did not learn that 1 billion pounds of synthetic pesticides are being sprayed on our food every single year. 99% of the farmland in the United States is sprayed with synthetic pesticides, many from China and Germany. And these invisible, tasteless chemicals are strongly linked to autism, ADHD, sex hormone disruption, thyroid disease, sperm dysfunction, Alzheimer's, dementia, birth defects, cancer, obesity, liver dysfunction, female infertility, and more, all by hurting our metabolic health. I did not learn that the 8 billion tons of plastic that have been produced just in the last 100 years, plastic was only invented about 100 years ago, are being broken down into microplastics that are now filling our food, our water, and we are now even inhaling them in our air. And that very recent research from just the past couple of months tells us that now about 0.5% of our brains by weight are now plastic.
If we really truly want to address the chronic disease crisis in this country, we have to start by preventing these diseases from occurring in the first place.
I'm hopeful that this leads, no matter who's in the White House, to a real program to start focusing on the chronic disease epidemic. Over half our kids have a chronic health condition, and it's something like over 2/3 of adults. This is really whether it's obesity, whether it's diabetes, whether it's allergies, whether it's ADHD. It's just pervasive. And we pay the most as a country, Hilda, and we have the worst health.
That doesn't make any sense to me.
Well, it does. It doesn't make any sense. It's a really, it's a low-value health system in this country, and we deserve better, and we can definitely do better.
You, as consumers, have a lot more power than you realize. Most of what we talked about today were top-down solutions of how we can work with government to help. But the fastest way to help is if consumers start boycotting with their wallet. I say this without exaggeration, that if any one of these public companies mentioned today, or any of the large companies that you know of, the big food companies, if they had just a 5% drop, just 5 in sales, if you had, all of you here, or hopefully there's some very, very, very large influencers listening, or celebrities, if any one of those people came out and said, do not buy U.S. Kellogg's cereal until they put in the same ingredients that they sell abroad, and that caused sales to decline by 5%, just 5, in 1 quarter, they would change this overnight.
All of these advocates and the political leaders have all given us a reason for hope. And they're leading a battle for the heart, for the soul of our country. And it's a spiritual battle, and that's something we all need to understand. The American Revolution started with a very, very small core of activists who were able to articulate these new set of values, and they did something that nobody in the world could believe. A ragtag group of people brought to its knees the greatest empire in the history of mankind. We can take our country back from these industries, and we can restore not only our democracy and the integrity of it, but most important of all, we can begin restoring our children's health.